Okay, so I have it set to the thyroid, and that's what we're going to start with. I'm not sure exactly what we'll find. We're going to look at my own thyroid. I don't think I have thyroid problems, but let's throw some gel on here, and let's take a look. Oh, that's way too close, way too close. And I prefer this way. Way too close. So I'm going to zoom out here a little bit. Okay, my focus is way too high too. Yeah, that's better. That's better. Okay. So we have our carotid artery vein, right? The vein's compressible, the artery is not. We have our thyroid here, and so we just want to screen through the thyroid, and we're looking for nodules, something like that. We screen through, screen through. Oh, I have a nodule. Oh, it's tiny because it's winking in and out of existence. Right there. Skinny. So I can go back a few frames, try to find where it seems the biggest, right about there. I can take measurements, right? You want to take measurements of the dimensions, because the dimension's going to be important. So I could take a length there. I could take another length here. Of course, whenever you're trying to measure pathology, you should try to image in two planes. About like that. And of course, if I want to delete these, I can just click on them to delete them. And so I can save that image there. And let's unfreeze. So here I'm not using the freeze button on the tablet. I do feel secure enough that I can press the button on the unit, but sometimes my hands... Anyway, again, the awkward button positioning when using the linear side. So if I find that again, and let's move that to the center, and then let's rotate. There it is. Okay. Again, I can go frame by frame, find where it looks the best, maybe there. And again, I can measure the dimensions again. And of course, there's criteria for whether a nodule is scary or not, whether it needs to be biopsied or not. And if you have one of these ultrasounds, you can monitor your patient. I had one patient, and I was encouraging them because it was sketchy. If you follow the criteria, this is moderate risk. She should have gone for a biopsy. And anyway, so I was monitoring it, monitoring it, and it disappeared. It went away. We could not find it anymore. I couldn't believe it. I was like, "Are you sure you're the same person?" It's not there. And it's very common to find these nodules, and most of the time they're benign, and it's fine. So I just had power Doppler on there for a moment because you should check to see if there's any changes in flow. So I just wanted to show that this unit, yes, it does have power Doppler. So here I have it on the carotid setting. And so now we have our vasculature, an artery, and a vein. Veins are collapsible, so if I give it a little squish, you will see it collapse. I could put on color Doppler. And if I monitor the size here, and move it, so I had to off screen here change the pulse repetition frequency a little bit because if it's not high enough, you get some aliasing artifacts, and even still we're getting some aliasing artifacts. But you can see that blood is flowing in different directions in both of these vessels, right? Because one's the artery and one is the vein. Let's turn that off so that frame rate gets much better. And let's put this dead center, and let's rotate. Okay, so I rotate it and I have the carotid artery in long axis now. And let's turn on, sure, maybe color. And we could steer that. Here, steer it the other way. Sort of cycles through. And let's say we want pulse wave, spectral Doppler.